To Nasarawa State, where the State AIDS Control Agency has disclosed that approximately 60,000 individuals have been identified as HIV positive and are currently undergoing treatment at various hospitals across the state. Ruth Bello is the executive director of the agency, and she revealed this during a one-day training session on youth and adolescent-friendly HIV and AIDS program, as well as prep for media personnel in Lafia, the Nasarawa State capital. Umar Muhammad tells us more.
The state scored very high in prevention and treatment, with prevalence rates of HIV now at just 2%.
The essence of this training is for media houses so that they can pass messages that are youth-friendly messages to people who are living with HIV, and also discuss about stigma and discrimination, because we know that's one of the drivers of the epidemic. Because we know worldwide we want to achieve epidemic control by 2030. And for us to achieve epidemic control by 2030, we want to know what are the things that are avoiding HIV and how do we overcome it, and in which we know stigma and discrimination is one of it, and also knowledge gap.
The state's anti-stigma law against discrimination of people living with HIV/AIDS has contributed to fostering marriages between HIV-negative and positive individuals without the fear of transmission.
The last survey that was conducted in Nigeria in 2018, the NICE survey put the prevalence of HIV in Nasarawa at 2.0. And of course, if you put 2.0 against the total population of Nasarawa, you can imagine the number of people we have. Over 60,000 people are already on treatment. And the plan by government and people of Nasarawa is to ensure that first we halt transmission so that we don't have new cases occurring, whether it's mother-to-child transmission or transmission between individuals, adults, married couples or married couples, adults in general.
We talk about stigma and discrimination as labels we give to people to demean them and reduce their self-worth. So if a young man is growing up and you stigmatize or discriminate him, already you have reduced his self-worth. And this thing can have consequences on the emotional status of that person.
Most of our members are the one partaking on the project. So we employ almost 62 of them working in our various community just to make sure they go into the community and then mobilize our women to go to the facility for ANC. And the essence of this is this: we want to be sure that by 2030, none of our children come out positive.
The virus can be transmitted through contact with infected blood, semen, or vaginal fluids. While there is currently no cure for HIV/AIDS, proper medication can effectively manage the infection and prevent disease progression.